Welcome to the MediByte channel. Today, we're unpacking a topic that affects millions but is so often misunderstood or just completely brushed off. We are going to explain, in a complete, detailed, and easy-to-understand way, menstrual cramps. In this explainer, we're going to decode the signals your body is sending you so you know exactly what's normal, what's not, and when that pain might actually be a huge red flag. Debilitating period pain isn't just something you have to grit your teeth and bear. So let's dive right in and uncover the science behind the symptoms. Here's our quick roadmap for today's explainer. We'll start with the basics of pain, compare primary versus secondary causes, explore pelvic venous disorders, cover exactly when to see a doctor, look at medical testing, and finish up with treatment protocols. All right, kicking things off with Section 1, the basics of menstrual cramps. 30%. Dysmenorrhea, which is the clinical term for menstrual cramps, really isn't just a mild inconvenience. It actively derails daily life, causing 30% or more of women to miss work or school. This pain usually sits right in the lowest part of the abdomen or pelvis. It typically hits its absolute peak about 24 hours after a period starts, and it loves to radiate straight to the lower back or down the legs. Plus, it's a whole body issue, frequently bringing along headaches, nausea, and just total fatigue. So what's actually causing all this misery? Biologically speaking, severe cramps are driven by high levels of these sneaky little substances called prostaglandins. These get released into your blood and tissues during menstruation. And what do? Well, they force the uterus to contract. In fact, it's a very similar mechanism to how the uterus contracts during labor. These intense contractions actually squeeze off blood flow to the uterus, giving you that deep, cramping ache. And as a biological double whammy, prostaglandins directly sensitize your nerve endings, making them much more vulnerable to feeling that pain. Moving right along to Section 2, primary versus secondary causes. Doctors basically split menstrual cramps into two totally different camps. Primary dysmenorrhea has absolutely no identifiable medical disease causing it. It usually starts pretty early, right in adolescence, and interestingly enough, the symptoms often dial back as you get older or after a first pregnancy. Secondary dysmenorrhea is a whole different story. It usually pops up later in adulthood, and the most crucial difference here is that secondary cramps are directly caused by specific, identifiable abnormalities or diseases hiding inside the reproductive system. So what exactly are these hidden abnormalities? Let's break down the usual suspects. First up is endometriosis, which is definitely the most frequent culprit doctors hunt for. This is when tissue that's supposed to line the inside of the uterus decides to grow outside of it instead. Next is adenomyosis, where that same tissue grows directly into the muscular wall of the uterus, causing it to swell up. Then we have fibroids, which are non-cancerous tumors made of muscle and fibrous tissue. And finally, cervical stenosis, where the passageway through the cervix is abnormally narrow or even completely closed. Any single one of these can turn a totally normal cycle into a highly painful event. Which brings us to Section 3, exploring pelvic venous disorders. Let's zoom in on this specific condition because it's a major hidden source of chronic pelvic pain. Think about the varicose veins some people get in their legs. Well, this is when that exact same thing happens deep inside the pelvis. The veins become widened, dilated, and totally convoluted, and blood just pools there. The pain has a super specific signature too. It's typically a dull ache that gets way worse at the end of the day, especially if you've been sitting or standing around for a long time. It's uniquely relieved just by lying down. Also, estrogen might actually play a huge role in developing these veins, making it super common for premenopausal women. Okay, Section 4, when to see a doctor. This is absolutely crucial, folks. If you experience any of these red flags, the DIY investigation stops, and you need to get professional care that exact same day. We are talking about sudden, severe pain or a constant pain that doesn't just ebb and flow like normal cramps do. If you have a fever, any sort of pus-like vaginal discharge, or a sharp pain that spikes even with a gentle touch to your abdomen, do not ignore it. These are not just bad period symptoms. These are urgent, blazing alarms demanding immediate evaluation to rule out acute emergencies or serious infections. That leads us right into Section 5, medical testing and diagnosis. When you do visit the doctor, they act like a medical detective following a logical step-by-step playbook. Step 1 is a complete menstrual history. They'll ask when your cramps first started, how heavy your flow is, and if pain occurs during sexual activity. Step 2 is the physical and pelvic exam to check for specific tenderness, enlargement of the uterus, or obvious things like polyps. And Step 3 usually wraps up the initial phase with a pregnancy test for anyone of reproductive age, followed by a pelvic ultrasound to get a visual on what's happening inside with things like fibroids or cysts. But hey, what if those first 3 steps leave everyone scratching their heads? That's when they bring out the advanced diagnostic tools. They might use techniques like sonohysterography or an NRI to spot harder-to-see abnormalities. They could use a hysteroscopy, which uses a tiny viewing tube to look straight into the interior of the uterus. Or they might go for a laparoscopy. This is a minimally invasive surgical procedure where a viewing tube is inserted just below the navel, letting the doctor literally look right at your pelvic structures. Honestly, it's often the absolute best way to definitively catch tricky conditions like endometriosis.
Finally, Section 6, Effective Treatment and Management. Let's talk solutions. For primary dysmenorrhea, we usually follow a progressive game plan. It starts simple on day 1. Think moist heat on the abdomen or some light exercise. If that doesn't cut it, we escalate to NSAIDs, like ibuprofen. But here's an absolutely game-changing tip from our medical sources. You actually want to start taking these 24 to 48 hours before your period even begins to get a head start on blocking those pain-causing prostaglandins. If that still isn't doing the trick, doctors might suggest daily hormonal contraceptives to prevent ovulation entirely, or even look into long-term hormone treatments like specific IUDs.
Now, if your diagnosis turns out to be secondary dysmenorrhea, the whole playbook changes. We're no longer just trying to mask the cramps. We have to go after the root cause. This could mean surgically removing fibroids or misplaced endometrial tissue. For those pelvic venous disorders we looked at, doctors can actually perform a vein embolization, where they use tiny coils or glue-like liquids to block the varicose veins so blood stops pooling. And in the most severe, persistent cases, things like nerve blocks or hysterectomy might be considered to permanently shut down those pain signals. We've covered a ton of ground today, from prostaglandins all the way to advanced laparoscopy. But if you take away just one thing from this investigation, let it be this. Debilitating period pain is not just a baseline you have to suffer through. It's a highly specific diagnostic clue begging to be decoded. So I'll leave you with this final thought. Are you really listening to what your pain is telling you, or have you just been trying to silence the alarm without putting out the fire? Thank you so much for joining me for this MediByte explainer. Empowering yourself with medical knowledge really is the absolute best first step toward better health. Please remember to like this explainer, share it with anyone who might benefit from decoding their own symptoms, and subscribe to the MediByte channel for more complete, detailed, and easy-to-understand medical insights. Catch you next time.